Hi folks, I'm going to show you a quick demo of the O2 Trainer. I've recommended this in my book and on a number of presentations, and it's a device, it's like dumbbells, lifting dumbbells for the diaphragm. Okay, it's an excellent device for strengthening the diaphragm. I've been using this for 2 years. When I track my spirometry, which measures my accessible lung capacity, and I'd been tracking that for about a year, and it was a pretty standard amount of lung capacity. I started using this device. It's a $39 device, or maybe $59 off Amazon. It's the O2 Trainer, and I started using that in September of 22. And it's in my book, actually, in the appendix of my book, my spirometry scores, and my spirometry scores jumped by a significant amount within a 2-week period of starting to use this, because it showed me immediately that it really accentuated the ability of my diaphragm to help me to inhale and exhale forcefully. So, that's important. If we've lost alveoli function in our lungs, then it's very important that the alveoli that we have there, maybe beneath all the scarring or in the crooks and nooks and crannies of our lungs, that we get air into those areas, which means we need to expand the rib cage from the diaphragm out and get as much oxygen-rich air down into those lower lobes of our lungs as possible. This device is terrific for that. It comes in a little package here. This is the O2 Trainer, the original 2.0 version, and it's got all these different size little end caps that go on it. And they start at a very wide type of a hole, and they get down to a very small hole, about so big, little tiny hole like that. Okay, my device actually has, the one I've been using since probably the first week, is the tiniest hole you can find. Okay, because here's why. I mean, if I'm inhaling, the idea is that I want to have a lot of resistance, a lot of resistance with the inflow of air as I inhale. And so with this large hole, you're just breathing like normal, really. So it's not going to provide enough resistance that you're really having to push out that diaphragm and really expand that diaphragm when you got these big holes. So I quickly went down to the very smallest, next to the smallest hole, and then graduated to the tiniest hole. And so you're sucking, I'm basically sucking air through a pinhole when I inhale using that. Okay, and the exhalation just is an end cap that just lets the air blow past it. You need to check that occasionally. If you're not, it has to, when you're drawing in air, it should seal up and close completely. Okay, and if not, you need to twist the knob around a couple times and make sure that it's sealing up completely, so that you're not pulling air in through that, because that's the exhaust hole. That's where the air blows out. You also want to turn it so it doesn't blow the air into your eye when you let the air out. Okay, so so you put the end caps on like so, and I also wash this thing out with water every night. One time I went through about a month or so and didn't wash it, and it gets really gummed up. So guess what? You're inhaling all kinds of moldy saliva that gets stuck in that thing. So you don't want to do that. You want to rinse it out frequently. Okay, now there's 2 exercises you do using this device. And one is for the front of the lungs, okay? And I'm going to turn it sideways so you can see. It is, you start in a lowered position with your chest almost on your knees, and you're going to raise up as you breathe in, okay? And then that's the front side. I'll go over the back side in a moment. So anyway, you put your end caps on and test it. I hold my mouth over that whole thing. Wet your lips so you get a good seal, okay? And I'm going to demonstrate what you're doing. You want to take a count of about 5 as you pull up. So naturally, if you've got a big giant hole in the end of that thing, you're not going to get enough resistance, and it's going to be 1, 2, 3, 4, 5. You're going to be like, your lungs will be full of air very quickly. So you want to really have to pull and work hard. So here I'm going to demonstrate this, the front version of this for the lungs. You do 30 of those. You may have to work up to it, but it's exhausting, because if you've got a small hole that means you're really pulling hard. And you notice I still got my oxygen cannula on because I'm not just going to breathe in oxygen and not have some oxygen flowing into my nasal cavity that gets into my throat, into my lungs. But anyway, so you're going to have to breathe really hard, and it'll be that 5 count of raising up. I'm typically sweating at the end of 30 repetitions of that. It's hard. I have to stop at 10 or 15 sometimes, or rest for a few seconds, and then finish out the rest of it, because I'll demonstrate it one more time. Okay, remember it's inhaling from here up for a count of 5. Okay, exhale, let the lungs collapse, let the diaphragm relax and go back in, stomach gets flat, and then pushing with the diaphragm, blowing out like a basketball. Your belly's going to push out when you're inhaling. So here we go again. I'll put my hand on my belly. You may be able to see that better. Okay, so that's the front part. The back side is a little more unique. Okay, I want you to look at my finger and think of my finger as this is my head, this is my body. Okay, and this is the, say, the lower part of my back, my knuckle. Okay, what you're doing is when you on the back side, you're not lifting up, you're actually pushing down while you breathe in. Okay, because what you're trying to do is push those back muscles out wide. You want to expand them that way and curve them back that way. So it's like that. It's what the back muscles look like. They want to push back a little bit. So it takes a little to get used to that. And you do 15 or 20 of those. I don't do them on the same day. I do 30 of the front one day, and then I do 20 of the back the second day. I'll demonstrate this one. Okay? And I don't know that you can see it very well, but what you're trying to see is that I'm going to bend over like this as I breathe in. I'm still pushing my abdomen out, okay, but I'm also going to try to flare my back like a weightlifter or a bodybuilder who flares out the muscles of their back, the lats. You want to flare out your back because you're trying to spread those intercostal muscles of your ribs to allow full expansion of the back, because we breathe a lot from our side and our back also to expand our lungs. So those muscles are important. Here, I'll do this one now. Okay, that should be it. Front side, really hard work. Back side is also, but not quite as hard for me, and you don't do quite as many of those. Anyway, the O2 Trainer, a terrific device. If you have any questions, send me an email. How do I turn it off? How do I turn it off?